Good afternoon. My name is Ernesto Delgado, and I'm going to be explaining what and how Tommy John surgery procedure have saved many careers in Major League Baseball. Every year, there are injuries that occur in Major League Baseball. Some are minor, some are major. But the most common injury in Major League Baseball is the tearing of the UCL ligament, otherwise known as the ulnar clavicle ligament. This procedure has been called Tommy John and is becoming more uncommon in baseball. What is Tommy John? Like I was saying, Tommy John is the tearing or straining of the ulnar clavicle ligament, otherwise known as the UCL. UCL injuries used to end many baseball careers for many athletes. UCL injuries occur when athletes who throw overhand, particularly pitchers, cause stress to the median part of the elbow. Well, those injuries have changed due to a doctor named Frank W. Jones. How did the UCL reconstruction get its name, Tommy John? Well, it all happened when Tommy John, former Major League pitcher for the Los Angeles Dodgers, got hurt. He injured his UCL ligament, and he was able to get it reconstructed by Dr. Frank W. Jones. Although he was the first patient to have this surgery done, the surgery got its name Tommy John. The history of Tommy John. In 1974, the procedure was done by a promising sports orthopedic surgeon, Frank W. Jones. And what does the Tommy John consist of? The Tommy John consists of and replaces the ligament with a tendon from somewhere in your body. The ligament is preserved after the tendon is used in the area of the elbow to prevent the injury from occurring again. Now you have a brief idea what the Tommy John surgery is. I'm going to be explaining the rehabilitation side of it. The rehabilitation side is fairly lengthy. It can last, most of the time it lasts from 10 to 15 months of recovery time. It all starts with intense physical therapy right after surgery, day after surgery, and that continues with extensive physical therapy for 8 to 10 weeks. After the lengthy and extensive physical therapy, the strength and conditioning part begins. What this allows you to do, it allows the patient to gather its strength and conditioning, return the strength that they've lost due to the surgery. And then finally, you return back to throwing. This process starts about the 8th to 10th month, and it starts with light throwing at short distances, usually between 45 to 60 feet, and it goes all the way out to 180 feet, allowing you to gain strength and conditioning back in your arm. Eventually, getting you ready to be back on the mound, in which you start a light program to return to a normal play. Now that you have a brief idea of what is the history, the rehabilitation of the Tommy John surgery, now I'm going to give you a few examples of some patients that have had the Tommy John surgery. Retired St. Louis Cardinal pitcher Chris Carpenter had the surgery done in 2007. He was able to return back to play in 2008. And after Tommy John surgery, he was able to win his second World Series. Current Washington National pitcher Stephen Strasburg had his surgery done in 2010. He was able to come back 2012 as an All-Star. Retired pitcher, Chicago Cubs, Kerry Woods, had his surgery in 1999, and after completing his surgery and having it done, he was able to come back to win becoming a two-time All-Star. These are just a few Major League Baseball players who have had this Tommy John procedure done. In conclusion, Tommy John injuries can happen to little leaguers or Major League Baseball players. Tommy John used to be able to take and end many careers, but that all changed thanks to Dr. Frank W. Jobes. Tommy John procedure has become a great example of modern medicine today at its best, allowing athletes of all kinds with UCL injuries, other known as the Tommy John procedure, continue their careers, especially those in Major League Baseball. Thank you very much. Have a great day.